Hello all, welcome back to my channel. This is Dr. Sonia Musakuti and today in my video I will be continuing the final part of the oral mucous membrane. So in this part I will be mainly dealing with the areas of oral cavity with keratinized and non-keratinized epithelium. So please don't forget to subscribe my channel, and if you like my video please click the like button. So coming into the topic, the areas of oral cavity with keratinized epithelium are masticatory mucosa, specialized mucosa and the vermilion border of the lip. The gingiva and the hard palate comes under the masticatory mucosa, and the dorsum of the tongue comes under the specialized mucosa. As I told, the masticatory mucosa includes the gingiva and the hard palate, which are having similarities for their keratinized epithelium but show differences in the submucosal layer. So, coming into the details of hard palate, the mucous membrane of the hard palate is tightly fixed to the underlying periosteum and therefore immovable. And this hard palate can be divided into 4 zones based on the difference in the structure of the submucosa. The zones are gingival region, which is adjacent to the teeth, the palatine raphe, which extends from the incisive or the palatine papilla posteriorly, the androlateral area or the fatty zone, which is present between the raphe and the gingiva, the posterolateral area or the glandular zone, which is present between the raphe and the gingiva. The submucosa is not found beneath the palatine raphe. Here, the lamina propria blends with the periosteum. This submucous layer is only found in the regions extending between the palatine gingiva and the palatine raphe. The lamina propria of the mucous membrane is attached to the periosteum by dense bands and trabeculae of fibrous connective tissue. The submucosal space is divided into irregular intercommunicating compartments of various sizes. These are filled with adipose tissue in the anterior part and with glands in the posterior part. The distance between the lamina propria and the periosteum is smaller in the anterior region than in the posterior parts. So next we can go into the details of gingiva. As you all know, the gingiva can be divided into 3 parts: the free gingiva, the attached gingiva and the interdental papilla. The dividing line which is present between the attached gingiva and the free gingiva is called the free gingival groove. The interdental papilla here is the part of the gingiva that fills the space between the 2 adjacent teeth. In 3-dimensional view, the interdental papilla of the posterior teeth is tent-shaped and pyramidal in the anterior teeth. When the interdental papilla is tent-shaped, the oral and the vestibular corners are high and the central part is like a valley. This depressed part is called caul, and this caul is covered by thin non-keratinized epithelium and is vulnerable to the periodontal diseases. The connective tissue of the gingiva contains small number of lymphocytes, plasma cells and macrophages in the normal gingiva, which is subjected to the sulcus and are involved in the defense and repair. The gingiva have various collagen fibers that are arranged in various groups, which are referred to as the gingival ligament. These are dendogingival, alveologingival, circular fibers, dendoperiosteal and the accessory fibers, which are called as the transeptal fibers. So what are these dendogingival fibers? These are fibers which extends from the cervical cementum into the lamina propria of the gingiva. These dendogingival fibers constitute the most numerous group of gingival fibers. The alveologingival fibers arise from the alveolar crust and extend into the lamina propria. The circular fibers are a small group of fibers that circle the tooth and interlace with the other fibers. The dendoperiosteal fibers can be followed from the cementum into the periosteum of the alveolar crust and of the vestibular and oral surfaces of the alveolar bone. The next keratinized area in the oral cavity is the vermilion zone. The vermilion zone is a transitional zone which is present between the skin of the lip and the mucous membrane of the lip. The inner aspect of the lip is thicker non-keratinized labial mucosa. Like the skin, the transitional zone is exposed to the atmosphere, but unlike it, there are no glands to keep it moist or prevent it from drying. Next, we can go into the details of specialized mucosa. The superior surface of the tongue is rough and irregular. A V-shaped line divides it into anterior part or body and a posterior part or the base. On the anterior part, there are numerous fine pointed cone-shaped papillae that give it a velvet-like appearance. These projections, the filiform papillae, are epithelial structures containing a core of connective tissue from which secondary papillae protrude towards the epithelium. Between the filiform papillae, there are isolated fungiform papillae. These are round, reddish prominences. In front of the dividing V-shaped terminal sulcus between the body and the base of the tongue are 8 to 10 valate papillae or circumvallate papillae. They do not protrude above the surface of the tongue but are bounded by a deep circular furrow so that their only connection to the substance of the tongue is at their narrow base. On the lateral surface of this circumvallate papillae, the epithelium contains numerous taste buds. The ducts of small serous glands, which are called as von Ebner's glands, open into the trough. They may serve to wash out the soluble elements of food and are the main source of salivary lipase. The next one is the taste buds. The taste buds are small ovoid or barrel-shaped intraepithelial organs that are about 80 micrometer high and 40 micrometer thick. They extend from the basal lamina to the surface of the epithelium. Their outer surface is almost covered by a few flat epithelial cells which surround a small opening which is called as the taste pore. The taste buds are numerous on the inner wall of the trough surrounding the circumvallate papillae, in the folds of the foliate papillae, on the posterior surface of the epiglottis, and on some of the fungiform papillae at the tip and the lateral borders of the tongue. So next we can go into the non-keratinized areas of the oral cavity. These include the lining mucosa, the lip and cheek, the alveolar mucosa, the inferior surface of the tongue and the floor of the oral cavity, and the soft palate. So coming into the lining mucosa. All the zones of the lining mucosa are characterized by a relatively thick non-keratinized epithelium and a thin lamina propria. The epithelium of the mucosa of the lips and of the cheek is stratified squamous non-keratinized epithelium. In the case of inferior surface of the tongue and floor of the oral cavity, the mucous membrane in this area is thin and loosely attached to the underlying structures to allow for the free mobility of the tongue. So that comes to an end to my brief section of the keratinized and non-keratinized areas of oral cavity. I hope all of you found this video useful and interesting. Thank you.